So I usually explain that to patients as it being the chemical factory for the body. So it's a highly complex organ. It probably has 100 different chemical metabolic processes going on within it. It makes bodily proteins of different kinds. It removes toxins. It receives the nutrients after you've eaten them. The first place they go from the bowel is to the liver to be processed, to some extent to be detoxified. And specifically, it produces a fluid called bile, which travels down the bile duct down into the bowel and helps with digestion. So the first thing to say is that liver function testing is in fact a group of blood tests, some of which test the pure liver function, in other words, how it's working, and others look for dysfunction, in other words, whether it's being upset by something. And these are all grouped under that heading, but they are quite different tests. It's one of the commonest blood tests that's done. It's often done quite routinely as a sort of panel when just looking at ill patients for all sorts of reasons. If one's more worried about liver problems, one might be thinking about patients who drink too much, patients who have drug side effects, patients who have symptoms like jaundice, going yellow, although it's important to say that a lot of liver disease, particularly ongoing chronic liver disease, has no symptoms at all. So they can indicate a wide range of problems, sometimes in the primary within the liver and sometimes secondary. So if we take the secondary ones first, the liver is upset by a whole range of different things. It may be upset by other illnesses, infections, maybe major sepsis. We're seeing a bit of liver upset with COVID these days. So a wide range of infections can transiently upset the liver, even if it isn't a primary liver problem. There's hardly a drug in the book, in our Bible of medications, that doesn't include some sort of liver upset within its reported side effects, some very well known and in common, some very rare. Alcohol upsets the liver a great deal, so we often test the liver in that situation. Obviously, if the patient has symptoms, they are yellow, jaundice, which is a primary liver symptom. If the liver is large and the doctor can feel it, that can indicate serious liver problems. And we're always worried, particularly in older people, about cancer within the liver, which is usually a secondary cancer coming from somewhere else in the tummy often, but occasionally is a primary liver cancer, which we're seeing a bit more of these days. No, on the contrary, the vast majority, I would say, certainly the majority of slightly abnormal liver function is not a cause for concern. Patients do get very fixed on the figures, but it's important to put them in context. So for instance, ALT, which is one of the more sensitive liver enzymes that indicates possible upset in the liver, the normal range in most laboratories is up to about 50. We often see patients where the value is sort of 80 or 100. The patient gets very worried about that, but in fact, when the liver is greatly upset, perhaps by an acute hepatitis or a major drug side effect, the value of ALT can be several hundred or indeed several thousand. So mildly abnormal liver function are usually not serious. There's also the distinction between something that's currently upsetting the liver, but maybe quite transient, and having major chronic liver disease. And paradoxically, if you do have major chronic liver disease and it's progressing over years, as the liver is damaged and there's less of it, less liver cells there, the liver function may get less abnormal, even though the liver disease is getting worse. So interpreting liver function is quite subtle. Obviously, many doctors do it to some extent, but often it needs gastro or liver specialists to really put the fine tuning on the interpretation. So like any bit of diagnosis, taking the history, in other words, talking to the patient, asking them specific questions about their symptoms and problems. So do they drink alcohol and to what level? Do they take any medication that might be upsetting the liver? Do they have any symptoms, jaundice, tummy-related non-specific symptoms? Some liver diseases have a familial history, so what's been going on in their family? Could they have picked up some kind of hepatitis? So have they been traveling abroad? Have they had any food poisoning? What is their sexual history? Because particularly hepatitis B is sexually transmitted. So all of these questions on the history. Examination is important, although actually often doesn't tell us very much. Can we feel a large liver? A series of repeating the liver function will be important, particularly after a period of time, a few weeks, to see if it's persistently abnormal or very transient. Doing tests for, could there be viral hepatitis present? There's a series of very accurate tests, possibly tests for rarer liver diseases, and then some sort of liver imaging, usually initially by ultrasound scanning, which is simple, safe, quick, and accurate, and possibly more detailed liver scanning with other bigger scans, CT or MR. And the gold standard of liver diagnosis is the liver biopsy, of taking a minute piece of liver out with a needle under local anesthetic. That's a comparatively simple test, gives a huge amount of information, but it does carry a tiny risk of serious side effects. So we use it quite sparingly. And nowadays we have another diagnostic tool called a fibroscan, which is a sort of quantitative ultrasound. It produces a figure rather than a measurement, rather than a picture. And it tells us about the degree of scarring in the liver. So is there a chronic process which is beginning to scar and damage the liver? And could that eventually end up with cirrhosis, which is a permanent, irreversible scarring of the whole liver? So now that we have fibroscanning quite widely available, we are doing much less liver biopsy, and that's a very good thing.